Facelift and neck lift procedures are very common. Here is an example of someone before and after a face and neck lift. One of the most common questions Dr. Patel receives is, what's the difference? His technique involves treating the lower part of the face with a facelift, focusing on the jawline and addressing areas such as jowls or sagging. A neck lift, on the other hand, targets the region below the jawline. This illustration shows how both procedures are performed. The neck is sculpted, while the facelift helps lift any unwanted sagging. Starting with the lower facelift, the incision Dr. Patel makes typically begins under the sideburn and varies in length and design based on the patient. Sometimes the incision extends in front of the hairline to lift sagging in the temple region. It continues in front of the ear, behind the tragus in most patients, under the earlobe, and then behind the ear. If a neck lift is performed simultaneously, an additional incision in the neck may be made to access the underlying anatomy. These incisions are designed to camouflage well over time. How do you know if a lower facelift will benefit you? Many patients test this by lifting their cheeks up and back to see if it improves their appearance. If it does, a facelift may address their concerns. However, it's essential to understand what a lower facelift cannot do. Areas like the forehead or temples may require a brow lift or temporal lift, while the eyelids might benefit from blepharoplasty. A deep, plain facelift can improve the nasolabial folds, the lines extending from the nose to the corners of the mouth, but over-tightening the skin should be avoided to maintain a natural look. Dr. Patel often hears patients say they want to look rejuvenated but not overdone. Achieving this natural appearance requires addressing multiple levels of facial aging, including the skin, bone, and fat. Healthy, vibrant skin plays a significant role in rejuvenation, though it is sometimes undervalued. For example, one patient underwent upper eyelid surgery and CO2 laser treatment to address pre-skin cancer lesions, achieving a refreshed, natural appearance. Another patient, who wanted improvements to her brow, eyes, nose, lower face, and neck, underwent staged treatments. Dr. Patel performed a lateral brow lift, rhinoplasty, and skin treatments, demonstrating how small steps can lead to noticeable rejuvenation. When it comes to the neck lift, multiple anatomical elements are addressed. These include pre-platysmal fat, fat just beneath the skin, the platysma muscle, a superficial neck muscle, subplatysmal fat, deeper neck muscles, and sometimes the submandibular glands. Aging also affects the jawbone, which becomes smaller over time, contributing to neck aging. Dr. Patel addresses these issues by sculpting fat, tightening muscles, and repositioning tissues to restore the neck's youthful contour. For patients with significant skin laxity or muscle banding, Dr. Patel reconstructs the hammock effect of the platysma muscle by suturing its edges together. Additional fat or gland issues are sculpted as needed. Incisions heal well and are minimally visible over time. Recovery from a facelift or neck lift generally requires about a week of downtime, though most swelling resolves within 4 to 6 weeks. Patients should avoid heavy lifting and contact sports weeks. Dr. Patel uses advanced techniques, such as hemostatic sutures, to reposition the skin, reduce swelling, and prevent complications like hematomas. Drains may be used in certain cases, depending on the patient's anatomy. For outpatient surgery, most patients feel comfortable returning to remote work or light activity after 1 week, provided they are not on pain medications. Swelling is managed through specific recovery techniques, and Dr. Patel emphasizes careful post-surgical movements to protect the sutures that provide support during healing. If you have questions or would like more information, consultations are available to discuss your concerns and goals. Feel free to reach out to Dr. Patel's team for guidance.